I am joined in the TechXLR8 studio by Sam Shah, who is Director for Digital Development at NHS England. Sam, thank you very much for joining us here today.
Hello.
So, you are one of the change makers for London Tech Week 2018. Congratulations.
Thank you. But it's also a bit scary.
I want to find out a bit about what brought you into the digital space, and I guess has brought you on this journey to be where you are now with NHS England, but has also inspired you to be someone who is a catalyst for change.
Well, if I think about my past, I was really lucky. I got to work with some amazing digital firms, changing the way that customers out there interact with banks, with retailers, with e-tailers, with other parts of the system. And that really taught me about what does digital mean and what does it mean for the consumer? How can we get a great digital experience for consumers? And the other part of my world is, of course, healthcare. I am a public health physician, and part of what I do is all about reducing inequalities, making it easier for society to access health services, make sure those services are available, and also to try and provide the best outcome for our patients. If I think the combination of those two things, I can see on the one side, I have a health system which has scarce resource, that has an increasing demand placed on its services, and this population that keeps growing. On the other side, we have the digital avalanche that's coming towards us, but at the same time, the opportunity for people to interact with society in a different way. And the combination of those two things actually drove me into digital healthcare.
That makes a lot of sense, you know, and particularly the opportunities, as we're seeing here at London Tech Week and at TechXLR8, there are so many opportunities in terms of embracing data and how customer experience, user experience, patient experience in health and care can certainly be improved by organisations that embark upon digital transformations. In terms of the work that you've been able to see through so far in your role, are there any examples, any work that you're particularly proud of, places where you've seen digital make a real difference to health and care delivery?
I mean, there's lots of great examples of where digital comes into the NHS. The NHS has been great about innovating different types of digitisation, whether that's for the patient, whether that's for joining up systems, whether that's for clinicians and the way that they work. But the one that sort of strikes out for me that people will be able to resonate with and understand really is the one about accessing urgent care online. So about 5 years ago, we started testing out what would NHS 111 appear like if it was an online platform, an online channel, and we started testing that in small parts of the country, and eventually we got to the point where last year we were able to launch 111 online, and that was a particular change for me because we know that there's been increasing growth in the number of calls to 111. There are more and more people seeking urgent care, and there are more people that want to get advice when they're at home or when they happen to be at work, and they might not want to go into their own practice or into a hospital setting. So we had to do something differently, and that was 111 Online. And what 111 Online does, it allows patients to connect with urgent care through an online channel, whether that's through their phone or through their computer.
It sounds pretty obvious when you put it like that. What were the main challenges then in terms of bringing 111 Online to market?
I think there are lots of difficulties, and if we think about the history of it, we've got the fact that the NHS is not one organisation. It's made up of thousands of organisations connected either through people, through systems, or even through technology. So we had to find a way of creating something that bridged all of those differences. We don't have a homogenous society. The population is completely heterogeneous. There are different people out there who speak different languages, that are of different degrees of digital literacy, that exist in different parts, even the speed at which they can connect to the internet varies across the whole of the UK. And for that reason, we had to work out something that would span all these differences. And if we think about the fact that people out there are just seeking care, they just want to get to a clinician in the quickest way possible so that they can have their problem dealt with in an efficient way to get the best outcome. And we had to find a way of making sure that we kept the patient at the forefront of this, but at the same time recognise the entire sort of diversity in our health system that exists.
How far does your crystal ball extend? You know, when we're talking about the change that technology is able to bring to us over the next 2 or 3 years, it's quite difficult. But in terms of your vision for NHS England and what digital is able to deliver in terms of patient-centric care and, you know, end-user care with services like 111 Online, what do you see as being next?
I think patient centricity is really important. But we have to remember there are two partners in this relationship. There's the patients on the one side, there's the clinical professionals on the other side. So whatever we do over the next 10 years has to work for both of those. So some key things that I'd really like to see going forward is how do we use data to provide both information, knowledge and intelligence, all of those things that can help drive clinical decisions in a different way, whether that's information about the user and how they interact with health services, or information that results from their entire healthcare record and their health about themselves that they may have entered into a device. How do we put healthcare back into the hand of the individual so the patient themselves has access to their health records so they can make more informed choices and decisions about the way they live their lives and perhaps think about focusing on well-being in a way that we haven't done before? And what else can we do to bring in new technology? So one of the things I would like to see is how do we adopt technology that might exist in other sectors? So voice recognition, speech recognition, the use of virtual assistants, chatbots in a different way that could themselves be brought into healthcare to improve the efficiency of the way we run services. And then there's a new emerging world. And not for a moment would I claim to be an expert on AI or machine learning. But of course, that is emerging and coming towards us. So how can we make the best use of data to inform techniques that might be akin to artificial intelligence that could themselves help us make better decisions at the clinical interface with the patient? So those ultimately the areas which become about data. How do we make patient-facing services provide the best digital experience they possibly can? And then at the other side, how do we allow clinicians to make the best use of technology to inform their decision-making and support their decision-making? And those are the areas we probably want to really sort of focus on. And of course, none of us know what's going to happen in the future, but technology is evolving, and the great thing about things like Tech Week is that there's so many opportunities from other sectors that we haven't really seen in healthcare that we could use to influence what we do in the future. And if we take what we've seen with automated cars, with what we've got with smart homes, with other ways that people interact, even down to the things like contactless that people use on the underground network every day in London, we can see that there are plenty of innovations that could themselves be adapted and adopted for use in healthcare. So whilst I may not have a crystal ball, the great thing is there's learning from other parts of the system that I could take that would translate to part of the plan for at least the next 10 years. And certainly what we do need to keep on doing is pushing the boundary. We don't necessarily need to take no as an answer, but we need to balance that with clinical safety, what's best for the patient, and at the same time, the degree and rate of adoption that we need to transform care to make a sustainable healthcare system in the UK.
You mentioned so many things there about how London Tech Week brings together so many different technologies, whether it's 5G or IoT or artificial intelligence, and it's a melting pot to explore new use cases, which I'm sure you'll be looking at and your colleagues will be looking at here this week. I should say London Tech Week is keeping you quite busy this week, it's fair to say.
It really is. It's been such an exciting few days already, and I'm sure the rest of the week is going to be just as amazing. And what I've seen is the best of what we have in the UK in terms of the innovations that are taking place, the ideas, the conversations that's happening, and the new types of idea that's on the horizon that we could benefit from in the health system. And only yesterday was on an event which they were discussing the different types of data and how that can be leveraged. This morning I had a discussion with somebody about using sentiment from different types of speech and dialogue that's taking place outside, all of which have transference to the health system. So this is going to be a really exciting week for us. I'm really looking forward to finding out what else is happening out there in other parts of society, the system as a whole, and what we could take back into the health service to make an even better NHS as we progress.
Well, listen, Sam, it's great to have you here, and have a great week here at TechXLR8 and London Tech Week.
Thank you very much.